And we're back. I'm Dr. Yassir Sonbol. Let's dive right back into today's medical conversation. Hello, everybody, and welcome back to Real Medicine, Real Lives, where we're here to discuss real life medical issues and life-changing topics to see if we can improve our health. I'm your host, Dr. Yassir Sonbol, and today we're discussing the issues of diet during, for example, menopause. And we have a very excellent guest with us today, Bonnie London, who's a registered dietitian, an expert for over 20 years in the field, founder and CEO of London Wellness, and which has been in business for over the last 15 to 20 years. Thank you, Bonnie, for joining us today.
Thank you.
So I think a lot of people, menopause is obviously a big deal, and so clearly everybody goes through it at some point in their life. Every female at least goes through it at some point in their life,
yes.
Right? And so, it's one of those things where there's a lot of changes, whether it's hot flashes, weight gain, all sorts of things that may happen, and women may not understand what's exactly happening, because I would assume those things such as weight gain and fatigue, etc., proceed when they actually go through menopause. So it probably starts before they actually go through menopause and then kind of gets worse during menopause. So we're here to kind of break down the issues. So thanks for joining us to kind of help us with all this. So kind of just to start off, I'd like you to tell me, what do you think about, how does menopause really impact metabolism and weight?
Yeah, this is huge because I have many people that come to see me. I probably get a call at least once or twice a week where women feel that they're eating the same, they're exercising the same, but all of a sudden their body is definitely not the same. And particularly troubling is that fat around the abdomen. And it is not anyone's imagination, because a lot of changes are happening as we go into menopause. And the biggest thing is, for sure, obviously, with the drop of estrogen. And this has a lot to do also with the energy storage hormone, insulin. And as we go into menopause, we actually become more insulin resistant, meaning that your body is not as sensitive to insulin. And then on top of that, and like something cruel, cortisol, which we know about stress, but it also has to do with belly fat. We actually have more receptors after menopause in our abdomen for cortisol. So that means, yep, you are more likely to store weight around your abdomen in menopause. But then another thing that happens as a result of this change in estrogen. So when we're like teenagers before menopause, our fat cells are something called hyperplasic, meaning that they will multiply. So the subcutaneous fat that sometimes people don't like on our hips and thighs and whatnot, but that's the good kind of fat. That's like the healthy fat. But then, yep, as we go into menopause, they become hypertrophic, meaning that they grow kind of like big balloons, each fat cell, and these become more dangerous and become inflated. And it's more than, I would just mention, aesthetics, because that abdomen, and it's another word, visceral fat, is particularly dangerous, as you know, as a cardiologist. However, it's not all bad news, because there are a lot of things we can do.
Great. That was very enlightening. So, if people were saying, okay, what can I do during menopause to try to help me? So if they're looking at dietary changes, to try to help with the symptoms and just the physical changes that happen during menopause, what would be your recommendation to them?
Well, first, I would go back to mention that when a lot of people come, a lot of people think, oh, I gained weight, I need to eat less, exercise more. And typically, my answer to them is actually the opposite. We need to stop starving ourselves, and we need to be eating the right kinds of foods, which I talk about this ad nauseum, which is protein, keeping that blood sugar stable. I have walked many women post-menopause lose tons of weight by helping keeping their blood sugar stable. And also that protein can also actually boost the metabolism. And then exercise is the next part of it, because this chronic cardio, like going to spin class like 4 days a week, actually, guess what? It can increase cortisol. And again, So this is not a good idea either. So there is definitely some good science about kind of alternating your workouts, doing interval training of some sorts. And then I cannot emphasize this next one enough, is weights, and building muscle. This is huge, because once again, this has to do with not just your metabolism overall, but that insulin, right? So the more muscle you have, every time you eat a meal, you have more places for that glucose to go. So between those two, we can definitely, and I have definitely turned the ship around for many women.
Great. So would you say there's certain, if you had to advise people on certain nutrients or specific foods to use during this time that really help kind of keep a balance in that hormonal state, what would you recommend?
Well, again, besides getting adequate protein, which the recommendations are about 1.6 per kilogram. So for someone who's like, let's just say, 120 pounds, I mean, we're talking at least 100 grams a day about a protein. And other than that, absolutely a cornucopia of vegetables, fruit, and then do not be afraid of fat. Now, I am all talking about macronutrients here, but I have to say these are precursors to hormones, and we have shied away from fat from the 1980s, women going into menopause now. And this is a big mistake. So that is another big change. So definitely get rid of like any non-fat, no fat, anything. This is a game changer right there.
Yeah. I mean, I think it's really interesting that you brought that up, right? Because I think people really have a misconception about what dieting really is. I mean, you hear all these fad diets, right? So, paleo, keto, no carbs, carnivore diets. I mean, they're just kind of all over the place. And really, some of them work for some people and some of them don't. But I think the message maybe, I mean, I'm interested to hear your thoughts, when people come to you, about these diets, about these fad diets, because you mentioned a lot of different factors: insulin resistance, cortisol levels being high, which can lead to fat accumulation, insulin resistance, which doesn't allow you to digest your food appropriately, all these things that you talk about. And so, we've trained people to kind of look for these quick, fast ways of losing weight, which are, I think, in my opinion, non-sustainable. But I would love to hear your opinion when people come to you about this kind of stuff. And what do you recommend?
Well, you hit the nail on the head. This is an excellent question, because this is what I talk about. It has to be sustainable. Like, this is not about like losing weight for someone's wedding, although people come to me for that. I mean, but this is really for your life. So, I mean, there's all these different diets out there. And I always like to mention that I'm an omnivore. And I think, which means I eat everything. And I think this is really important as we are looking towards experts to get advice. You want to think about what diet that they are subscribing to, because there is going to be a bias there. And personally, yeah, I don't think there is like a perfect diet out there. I mean, certainly the Mediterranean diet, and once again, whole foods diet. But there is no question that, even among the experts, it is agreed that whatever diet is able to, that you can maintain and that can keep that insulin low, is going to be the best diet. So whether or not, again, the extreme of carnivore or even vegan, which to me would be much more difficult to adhere to, and you really got to know what you're doing, because I've seen some unfortunate situations with that, is what I would say.
I mean, would if people come to you and say, I just need to cut carbs out, when you hear that, because I hear that line all the time, as a healthcare provider, when people are talking to me about it, would you tell people that, no, you don't need to cut carbs. What you need to do is, have a certain amount of carbs? Because would you say it's equally important to eat carbs, protein, and fats, or is it best for some people to cut one of those out?
Yeah, I mean, as we get older, as I was mentioning, you become more insulin resistant, meaning that we don't tolerate carbs. So when we talk about carbs, vegetables are carbs, berries are carbs. So obviously, those carbs are much more slowly digested, and I'm definitely on top of those. But now, as far as the ones that actually can trigger break down to glucose and trigger insulin, yeah, we kind of want to back off of those, whether it be bread, which is a whole nother story, rice, potatoes, all of that. So I try not to wanting people to feel totally restricted because it's much more complicated than just not eating carbs. But actually, I think what's much more important is to focus on the foods we need to get in, right? So in other words, if you have some pasta with your salmon and broccoli versus like a bowl of pasta, that's like a whole different story. And then everyone is, again, an individual, and there are people that do need to cut back. And what is interesting to note, again, for this generation going through menopause, is that, believe it or not, we don't have any essential carbs. I just think that is very interesting.
So I'm curious from your perspective, because again, these are questions I get asked all the time. When people come to you as a dietitian and they're saying, I've really tried to diet, I'm not losing weight, and you think about insulin resistance and now new therapies that are out there, such as, Ozempic, Wegovy, all these semaglutide drugs that people are, trying to use. What is your opinion about that as a dietitian when it comes to using those medications?
Well, I think they can be a tool. I'm still learning about them, and I think they can be great. I think they have been mishandled, though. In other words, it doesn't take away doing the heavy lifting, like what I tell people to do as far as making those appropriate diet choices, and then, yes, exercising and building muscle. Unfortunately, and again, I've seen some tragedies too in my office. Some people, they have struggled with their weight for most of their life, and now all of a sudden, oh my goodness, I don't have an appetite, so they just think they could just not eat. And so it's nothing to do specifically with these medications that are out there. It's the fact that if you don't eat on any diet, bad things are going to happen and you're going to lose muscle. And if you don't work out and do all that. So again, I think they can be a tool. And actually, one of the more interesting things that have come out recently is the suggestion that maybe they can prevent metabolic adaptation. In other words, when people lose a tremendous amount of weight, what one of the major issues is that now they have to stay at that lower amount of calories and continue crazy exercise, where these medications may offer some benefit for that. But again, without proper, like maybe professional guidance, I think it can be kind of scary. How's that?
Thank you, Bonnie. That was really, really insightful. So, next we're going to talk about digestive health soon. It's something people struggle with all the time, but often don't understand why. So everybody, just stay tuned. We're going to go to a quick commercial. We're going to come back with a second part of our segment today. Stick with us. We'll be right back with more real stories, real breakthroughs, and real lives transformed.